Hello and welcome to this bonus episode of the EMJ podcast. I'm Dr. Hannah Moyer, Senior Medical Writer and Moderator for EMJ. Today we will be discussing CoMiSS, a rich decade of science and clinical practice. The publication of this podcast was funded by Nestlé Health Science. CoMiSS, the cow's milk-related symptom score, has proven to be a valuable resource for healthcare professionals, parents and carers alike, offering an easy-to-use awareness tool that supports the recognition of cow's milk-related symptoms in infants and young children. 2024 marks the 10th anniversary of CoMiSS, prompting us to look back at the rich decade of science and clinical practice behind the tool. We will reflect on the tool's inception, its impact on aiding earlier diagnosis, and its role in evaluating therapeutic interventions for managing symptoms of cow's milk allergy. Furthermore, we'll touch upon recent updates and future plans for the tool. Today, I have the privilege to talk with three esteemed paediatric experts and discuss the story behind CoMiSS. First, we welcome Professor Ivan van der Plas, Professor Emeritus and Consultant at the University Hospital Brussels at the Free University of Brussels in Belgium. Professor van der Plas first became head of the unit for paediatric gastroenterology and nutrition in 1987 and created the paediatric hospital, the Kids Health Castle, where he held the position of Chair of Paediatrics from 1994 until 2021. Professor van der Plas's primary interests lie in functional gastrointestinal disorders such as gastroesophageal reflux, colic and constipation, as well as infant nutrition, with a focus on probiotics, prebiotics, and cow's milk allergy. Over 10 years ago, he created CoMiSS in close collaboration with eminent colleagues. We are also honoured to have Professor Raanan Shamir, Chairman of the Institute of Gastroenterology, Nutrition and Liver Diseases at the Schneider Children's Medical Center of Israel, and he is also Professor of Paediatrics at the Faculty of Medicine and Health Sciences at Tel Aviv University, Israel. Professor Shamir's current research encompasses paediatric nutrition, allergy prevention, nutrition and growth, celiac disease, inflammatory bowel disease, and childhood hyperlipidemia. Finally, we are privileged to welcome Dr. Katerina Bayegova, paediatric gastroenterologist and assistant professor in the Department of Paediatrics at the University Hospital Brno and Medical Faculty, Masaryk University in Brno, Czech Republic. Dr. Bayegova's primary interests revolve around paediatric care, chronic allergic and immune conditions, and the role of nutrition in paediatric care. She, along with our other guests, has played a role as an investigator in the studies and research behind the development and implementation of CoMiSS. Welcome to you all, and thank you so much for taking the time to join EMJ today. So let's dive into this fascinating story that lies behind CoMiSS. Obviously, this is a very special podcast where we are celebrating 10 years of CoMiSS since its first development in 2014. Ivan, can you share with us what was the background behind its development?
It will be a pleasure to do so. CoMiSS is in fact a follow-up of the symptom-based score, which is a score that was developed 6-7 years before the creation of CoMiSS, when we were performing a double-blind randomized controlled trial in Belgium comparing two different hydrolysates for the management of cow's milk allergy. And so we created a score that allowed colleagues to just put one figure, one number on the severity of symptoms, and it was used to follow the evolution of those children on the therapeutic diet. And then that illustrated the need for something more, because apparently pediatricians, healthcare professionals do have difficulties in being aware about the symptoms of cow's milk allergy, especially non-IgE mediated cow's milk allergy. So then 10 years ago, in 2014, in collaboration with eminent colleagues, we all came together to create the CoMiSS, which is that updated symptom-based score. So the CoMiSS score is created then 10 years ago in order with the goal to make healthcare professionals worldwide more easily aware about when a child may present with a combination of symptoms that may be indicative of possible cow's milk allergy. So that's the birth of CoMiSS, is making colleagues aware about when a child should be suspected of having cow's milk allergy.
Thanks, Ivan. And I guess there's a lot more context and depth behind the development. So perhaps, Ranan, you could bring in some more detail about what led to the development of this tool.
Well, first of all, I can only echo Ivan in what he said, remembering that indeed we started about 10 years ago in September 2014 with a workshop that involved many experts in the field. And as said by Ivan, we aim to achieve consensus on adapting the existing symptom based score as an awareness tool to recognize cow's milk related symptoms in young children. During that workshop, we evaluated existing data and explored the possibility that a clinical score derived from symptoms associated with the ingestion of cow's milk proteins could help primary healthcare providers. The CoMiSS score, which is the cow's milk related symptom score, was then born from this workshop. And in that score, we consider crying, colic, dermatological symptoms, gastrointestinal symptoms, and respiratory symptoms as an awareness tool for cow's milk related symptoms. Now, obviously, the score can be used to evaluate response to treatment, but it is not a diagnostic tool. And as said by Ivan, it is a tool for increased awareness. And the next step of the CoMiSS group was to start generating evidence to validate CoMiSS.
And I think it would be useful, Ivan, if I could just, given those symptoms that we've indicated, how this evolved perhaps from dispelling understanding or around lactose intolerance. I feel that that might be a key factor to consider.
Well, in fact, lactose intolerance is often misdiagnosed in those very young children because primary late onset lactose intolerance does, in fact, not exist before the age of 4 or 5 years. So, lactose intolerance in infants is almost always secondary to another disease, and that other disease is, for instance, cow's milk allergy. Lactose intolerance can also be secondary to gastrointestinal infection, but at this age, primary lactose intolerance does hardly not exist.
So I guess that's a vital point of having the CoMiSS tool to helping understand the underlying causes, for example, of symptoms. So what initially inspired you, Ivan, to be first involved? And can you talk me through your initial involvement in that development?
Well, as I said, the origin of CoMiSS is that symptom-based score, which we developed for that clinical trial. So from the beginning on, that score was a little bit our creation. And then together with those eminent colleagues, I was very pleased with that close collaboration because the more opinion leaders endorse it, the more value the score is getting, and then trying to use that score, make it an awareness tool to make colleagues worldwide more aware about non-IgE mediated allergy, as I said, because there is no real diagnostic test, may help infants to get better, because at the end there is both over and under diagnosis of cow's milk allergy. That means that in some situations, healthcare professional easily diagnose cow's milk allergy when there is, for instance, only one symptom, crying, or in other regions, healthcare professionals are not aware that combination of different symptoms may in fact indicate that possibility of cow's milk allergy. So the in close collaboration with those colleagues, helping to create a tool that really helps to better recognize symptoms possibly indicating cow's milk allergy is a real benefit for those infants and their families. And that's why I'm so happy to be involved and to stay involved in the further development of this tool, because it's improving all the time, and it still needs further improvements for the future.
And a wonderful development it has been. So, Ranan, could you maybe indicate why you became involved? What's the story behind your involvement?
Well, for me, it is very simple. The issue of cow's milk allergy, nutrition related, is one of the most important and challenging issues in pediatrics. And it combines three areas that are very close to my heart: general pediatrics, pediatrics nutrition, and allergy. So in that case, it was very stimulating for me to join a great group of experts trying to improve the usage of the tool in order to solve this difficult problem.
Thank you so much. And Katharina, you're there in the background. I think this is a great time for you to join us. So, what led yourself to also become involved in the development and implementation of the CoMiSS tool?
Oh, well, when getting in touch with CoMiSS for the very first time, I considered it might be a really helpful practical tool. It reflects the presence of symptoms possibly caused by cow's milk allergy and their intensity. I assumed clinicians and, of course, their patients too might profit from using CoMiSS when cow's milk allergy risk is an option. And I was also curious about how it operates in practice. In 2017, we published the first data on CoMiSS in Czech infants. And finally, I felt really honored when I was offered to become a part of the CoMiSS expert group in 2019.
Yes, absolutely. And I think what's wonderful about the CoMiSS tool is that it's not just thinking about what benefits healthcare professionals, it's taking on board everybody's perspectives and also helping and supporting parents and carers. So, as a mother myself, for some reason, cow's milk allergy always seems to be one of those common points of discussion between new mothers, and as their babies are growing and they might have symptoms or suspected symptoms that they have concerns with. I can often recall those queries we all had sitting around and discussing that and thinking, could these symptoms be associated with milk? So that's led to a nice link to help that support from healthcare professionals. So, Ranan, could you explain why the diagnosis of cow's milk allergy is so challenging and what impact this can have on a child, or how is the child perhaps affected?
Well, first of all, it is very hard to diagnose because the complaints and the symptoms are similar to those seen in many other conditions and diseases. And also, these complaints are typical of many completely healthy children. So we have overdiagnosis because these children are having other problems or are completely healthy. And we have underdiagnosis because people do not appreciate that those common symptoms are really related to cow's milk. Overall, we're talking about somewhere between 1 to 3% of the general population of infants. Um, there are studies showing lower numbers, but this is usually because of underdiagnosis. And we see it more in what we call non IgE cow's milk allergy because it is harder to diagnose. It is not immediate, and the complaints are non specific. Now, if we're talking about underdiagnosis, it has a lot of significance by causing unnecessary suffering, unnecessary anxiety. There is a waste of resources when you're looking for an answer where the answer is in cow's milk allergy. Obviously, there is reduced quality of life and morbidity with suffering, with symptoms, with undernutrition that at first can be just be with unseen or hidden deficiencies, but then at the end it comes to weight loss and overt symptoms of nutrient deficiencies. And overdiagnosis also have an important consequences. There is unnecessary anxiety. It also have an effect on quality of life, and there are unnecessary restrictions that can cause problems to the children, and obviously also economical significance. So altogether, we really need to get to the bottom of this and avoid both over and under diagnosis.
Absolutely. And I guess this tool, given its the way that it functions and how you can access it, can help globally support understanding and the diagnosis for this. So, Katharina, perhaps you could talk us through the different components of CoMiSS and explain why they are of importance.
First, I would like to point out whom is the tool not intended for. The tool is not intended for infants with severe and life-threatening symptoms, clearly indicating cow's milk allergy, including anaphylaxis, which requires urgent referral. Infants presenting with faltering growth and sick infants with hematochezia require an urgent referral and full diagnostic workup. This information is clearly stated in the heading of the CoMiSS tool and is supposed to prevent the misuse of CoMiSS. The subscores of CoMiSS evaluate the duration of crying per day, the number and volume of regurgitation per day, the consistency of stools according to Brussels infant and toddler stool scale, the extent of skin area affected by atopic dermatitis, the presence or absence of urticaria and angioedema, and finally, the intensity of respiratory symptoms, wheezing, cough, and rhinitis. Subscores should be recorded if the symptoms have been current for at least 1 week, except urticaria and angioedema, which are immediate and obviously related to cow's milk allergy. Having values of all subscores, you add them together and obtain the overall CoMiSS value. The maximal value of CoMiSS is 33, the minimal, of course, 0. A score below 6 means that the risk of cow's milk allergy is low. There is no need to proceed with obvious diagnostic steps. Scores of 10 and above signal a possible cow's milk allergy risk, and the standard diagnostic workup according to the ESPGHAN position paper is suggested. Wow. And then there are the overall CoMiSS values from 6 to 9. Infants presenting with such a score will profit from further monitoring, which will provide optimization of the assessment. Furthermore, in some studies, these values were associated with functional gastrointestinal disorders. I would like to mention also that CoMiSS is not a complicated tool. However, it needs to be used in conjunction with the user's guide to evaluate all subscores accurately.
And I guess these materials are easily accessible online. Ivan, perhaps you could give us some insight there and also talk through who would benefit most from accessing CoMiSS. Is there a particular healthcare professional that may benefit the most?
So this tool is easily available on the web, so everyone can find it. It has been translated already in many different languages, and I think that in fact as well doctors, and I mean by that family doctors and general pediatricians, as nutritionists, so dietitians or people who are interested into nutrition. So everyone who is from a healthcare point of view in contact with infants can benefit of this tool, and in fact make the infants benefit of this tool, of course.
And Ranan, you agree?
Yes, I definitely agree. Anyone where cow's milk allergy is not of his or her primary interest would benefit. Uh, Patients, families, they all meet nurses, dietitians, other healthcare providers, and I see it as a mission to make them aware of COMIS and teach them about it so they can be assisted in proper diagnosis of cow's milk allergy, or at least be aware and then make the proper steps. Again, this is an awareness tool, not a diagnostic tool, but it really can help them take the right path.
And what is it about the tool that has an advantage for healthcare professionals as well as parents, carers, and infants alike? What is it that has that advantage over other possible tools or methods?
Well, first of all, I'm not aware of other tools that perform or do this job that we want this tool to do. We talked about the fact that there is an overlap with other conditions, with other illnesses, and especially with healthy children. So, what we really want is that those primary healthcare professionals, when they're faced with all these complaints about crying, about the GI symptoms, the other symptoms that Katerina was talking about, we want them to have a tool that will help them rule out cow's milk allergy if the score is below 6, or take necessary steps if there is a suspicion of cow's milk allergy. Again, I emphasize that it's not a diagnostic tool. It just raises awareness and direct us to do the proper diagnostic tools. Obviously, later it can help them also follow those children, although we still are in the process of having enough science about this. And most importantly, it brings cow's milk allergy to its proper place in considering the cause of the symptoms.
Absolutely. And having yourselves as the experts of CoMiSS on this podcast is helping to broaden that awareness, and hopefully individuals will become more aware to advocate and include perhaps utilizing in training for healthcare professionals. So, Ivan, is there anything else you would like to add on the advantages?
Yeah, first of all, I would like to agree completely with what Ranan just has said, and maybe it will also help parents to decrease the healthcare burden by decreasing repetitive consultations to healthcare professionals if they use CoMiSS from the very first consultation onwards, and that way can more rapidly come to the suspicion of the right diagnosis.
Yeah, I completely agree there. I think it's a fantastic way of improving and I guess providing comfort to parents and carers in their understanding of what their children are going through. So, Katrina, if I could bring you in again, you've been involved a lot in the research of CoMiSS. Can you talk me through how CoMiSS has been utilised and researched over the past decade?
In 2022, a paper titled The Cow's Milk Related Symptom Score CoMiSS, a useful awareness tool, was published. The search for this review was performed in February 2022 and identified 25 original studies, 1 food analysis, and 2 reviews. When performing a very perfunctory search online nowadays, you will identify 14 papers in addition. Overall, there are more than 40 different publications since 2015, including more than 2,000 subjects, and for sure, there are more studies in the pipeline. The authors tested CoMiSS in healthy infants who presented with low CoMiSS values with a median of 3 and 4, Others checked its performance in studies on infants suspected to cause milk-related symptoms, showing that low CoMiSS after elimination with a median of 5 is predictive a positive oral food challenge. The range of sensitivity, specificity, as well as cutoff values suggest that CoMiSS may operate differently according to study design and type of presented symptoms. It has been documented that CoMiSS is effective as a tracking tool in clinical studies evaluating tolerance of treatment infant formulas. In contrast to other tools proposed to identify infants possibly allergic to cow's milk, there is strong evidence of CoMiSS as an awareness tool, but unfortunately, and perhaps fortunately, not a diagnostic one.
So we've had a lot of history behind the tool, lots of research and clinical studies there. And naturally, I'm sure there's a lot of evaluation and re-evaluation of the tool. Ivan, CoMiSS was updated in 2022. Could you just shed light on why and how the tool was updated?
Yes, well, because we had acquired enough evidence indicating that that update was needed. In fact, the original cutoff of 12 or more as cutoff tool for the awareness of cow's milk allergy was based on general consensus, but not on any clinical evidence at all. In the meantime, 25 clinical trials have been performed, all applying CoMiSS, and what came out of that is that a cutoff of 10 or more seemed to be more appropriate as cutoff for awareness of cow's milk allergy than the original 12. And what came also out of it, which is very logic, is that a very low score makes the diagnosis or suspicion of cow's milk allergy very unlikely. So that's why a cutoff of 6 was introduced as making cow's milk allergy very unlikely. And as also has been suggested, also thanks to all the experience acquired, decrease of CoMiSS during a diagnostic elimination diet is also quite indicating cow's milk allergy. We then changed also the original Bristol stool scale to describe the consistency of stools to the Brussels infant and toddler stool scale. Why? Well, because everyone who knows the Bristol stool scales knows that these stools are really stools of adults, and stools of infants in diapers look totally different. And so, again, in close collaboration with colleagues, of which Ranan was also part of, we developed a stool scale specially for non-toilet trained infant, which then was called the Brussels Infant and Toddler Stool Scale. And thanks to Katrina, we found a way how to change Bristol stool scales to the Brussels Infant and Toddler Stool Scale without changing without the need to change anything in the CoMiSS scores and the cutoffs used. And since CoMiSS was used more and more, shortcomings were highlighted, and that's why symptoms were added, such as acute urticaria and angioedema were added. So by using CoMiSS more and more, by getting information, evidence from clinical trials using CoMiSS, there was a need to update tool because, as I said in the beginning, there was hardly any evidence. And by doing trials, we accumulate the evidence concerning CoMiSS. And because of what we certainly do not want is that CoMiSS is perceived as a diagnostic tool. A very strong statement very clearly was added on the document of CoMiSS saying that it is an awareness tool and that it is not intended as a diagnostic tool. And so it clearly states that cow's milk allergy diagnosis should be confirmed by a diagnostic elimination diet followed by an oral food challenge, and that a CoMiSS score is only indicative whether that elimination diet and food challenge will be positive or not.
A lot of useful updates and insights there for clarity for those that use CoMiSS. Perhaps, Ranan, you could also give some insight on how we can help to further increase the awareness and utilization of the CoMiSS tool.
Well, I think all of us agree that any opportunity to discuss the tool should be encouraged, including, by the way, this podcast. Anything, any educational activity would be helpful to increase knowledge and awareness of the awareness tool. We should be assisted by guidelines that evaluate and present COMIS. Already, as Ivan alluded to, there are the ESPGHAN guidelines that already discuss COMIS, and there are others that we should just refer to. So pediatricians and healthcare providers understand that this is not just something that we, the COMIS group, are interested in, but it's really something of universal knowledge and a plan for action. And finally, obviously, we should plan many educational activities as possible to educate healthcare providers.
Ivan, do you have anything to add?
Well, yes, as CoMiSS Group, we can certainly continue to advocate for the CoMiSS to become more part of all different international guidelines. So we can hope that it gets part of the position papers, guidelines, recommendations of different scientific societies worldwide in order to get more used all over the world, and not only by us experts who developed CoMiSS.
And what is currently happening now in terms of future research regarding CoMiSS?
Well, the original data were concentrating on young infants between 0 and 6 months, and we absolutely needed data on older infants, 6 to 12 months old. So what we actually are collecting is data in this specific age group from 6 to 12 months in presumed healthy infants, in order to be able to better separate those infants with symptoms and signs from the normal population. And these normal ranges are very important to just show the parents that not every infant that regurgitates or has hard stools or cries has to be suspected of any disease, but that it can be as well part of normality. So I think what we are trying to do is also to use CoMiSS tool to convince parents about normality in all those infants. And at the same time, the original CoMiSS data in the presumed healthy infants were mainly from Europe, and we are collecting data from different parts of the world. So we are in the processing of publication of normal data from Indonesia, from Brazil, from Egypt. And they are all more or less the same range, but it's of course important to show that worldwide this CoMiSS score can be used and that the same cutoffs are valid for the infants worldwide.
And finally, Ivan, you have been involved in the whole journey of CoMiSS this 10 years now. What does the future hold for CoMiSS? Are there any future plans?
Well, I just came to say, collect more data, more information. Again, I think what is really important is to use CoMiSS also regarding normality, because a lot of parents go to look on the internet because of symptoms and signs that their infants present. And it's important that they find a tool that also reassures them that what they are looking for is in fact part of normality, and at the same time increases awareness regarding the possibility of cow's milk allergy. But so the healthcare professional then can also use that CoMiSS to reassure the parents about normality. And so the an important next step is also to be sure that CoMiSS gets where it needs to be, which is at the primary healthcare level. And that's always difficult to get this kind of tools to the right place where they should be used, because we as eminent experts, if you want, we do not have the way how to get into contact with those primary healthcare professionals worldwide. But that's where the tool is intended for. And so effort should be further made to bring the tool where it belongs.
I think that's a lovely conclusion to pull this summary together of this rich decade of understanding and the journey of CoMiSS. So thank you very much for your insights today. Unfortunately, that's all we have time for. You've delved into that journey, provided a lot of insight to the development, the impact, and hopefully the future. And thank you to for all of you for providing that awareness and insight. So I just want to take this moment to thank again Professors Ivan van der Plas, Professor Ranan Shamir, and Dr. Katarina Bayerova for sharing their valuable insights and expertise with us today. And again, thank you for providing this opportunity to bring this awareness to our audience, and hopefully it will have a good impact going forward. So thank you. This is a podcast on CoMiSS, a rich decade of science and clinical practice. The publication of this podcast was funded by Nestlé Health Science. I just want to take a moment to thank you, our audience, for taking the time to join us today. If you enjoyed this episode, there are more EMJ podcasts for you available to tune into on your preferred podcast platform or by visiting emjreviews.com, where you will find a wide range of interesting content on a variety of medical topics. Do not forget to subscribe wherever you get your podcasts. Until next time, take care and goodbye for now.